So in this video, we're going to talk about pain. There's really two main situations. One is from an injury or a past injury, or the other is no injury or no history of injury into that area. So those are the two main categories. I tell you, there's a lot of problems, pain just turning on without any history or any problem right here. And that's pretty much what I want to talk about, because if you do therapy on these type of areas of the body without getting the problem with the referral, like where it's being referred to as the root problem, you end up not really getting anywhere at all. So, of course, therapy works on an injury, but if they have no injury, let's take a look at what it could be. So, first of all, the right shoulder, right through here, up through here, into the neck, around the trap over here, this is referred by something called the phrenic nerve that comes from your gallbladder right here. So either when the gallbladder is removed, gallbladder's kind of congested, or you have some types of problems with lack of bile that's supposed to flow through there to help you digest because you're eating bad or you're eating a lot of nuts, that pain's going to go right up into the right shoulder and sometimes even right down here, right through in here. It's going to definitely go into cause headaches. So most of the headaches are coming from the gallbladder. Okay, so always look to the liver, gallbladder, for right shoulder stuff through here, or headaches, look at the gallbladder. Okay. Now, next thing is we're going to talk about left shoulder. It could be a heart problem. Now, I'm not saying it's a serious like heart attack, but what happens when the pulse rate goes high, the heart works harder and it anchors itself to the front of the breastbone and the back, and it creates a tightness. And that tightness could cause tension up here, up through here, all the way down to this arm. Could be the elbow, the hand. So that it could be a heart problem, and it usually is because the person's not sleeping or they're exercising too much and they're creating stress in their heart combined with not sleeping and stressed, and then they start getting this pain right here or a tightness on this side right here. Okay? Now, if the person has neck tightness or trap right through here, that's usually digestion. They need more stomach acids, or they have a congestive stomach and the food's not digestion. They usually have a lot of acid reflux or indigestion, and it's going to make the neck really, really tight. Now, being a chiropractor, I used to adjust these people 3 times a week for the rest of their life, and it would always just pop back out because I never looked at the digestive system. Okay, let's talk about the mid-back, like right back over here. That's if it's right in the center, it's going to be more of the heart that's anchoring itself and really, really tight because the person's not sleeping, they're stressed, and they're exercising too much. Or they even stopped smoking, and then all of a sudden the heart got weak because they stopped smoking and the body was dependent on it, and now you took that away and it never adapted. So they just never recovered from an injury. If we take a look at the lower back, it could be a problem with the uterus, heavy periods, fibroids, a hysterectomy, several babies. It creates a weakness in that area, and it can refer to the lower back in the center. It's called L5. Or it could be more of a prostate enlargement and could be referred to your lower back. Also, the next thing it could be is if it's the left or right hip joints, called the sacroiliac joints, that could be the left or right ovary problem. And you treat the back, it never goes away because the ovaries are referring pain back. If there's pain all over, it's called fibromyalgia, you want to check for the adrenal, because the adrenals control the anti-inflammatories, so when you run out of them, you end up with inflammation systemically. Okay, then we have the knee problem. The knee problem is usually an adrenal because the adrenal creates a catabolic effect on the quadricep femoris that connects to the knee and makes the knee weaker on that side. It also affects the collagen, so that collagen could make grinding and popping in the knee. And then we have the right leg or foot problem on the right side. That usually is liver, and it's referring problems down here, and usually their diet is very poor, they're drinking alcohol, and it's referring all the way down to that leg or foot or toe or ankle. Now, if it's the left ankle swollen and in pain, it could be a weak heart because the heart's not pushing blood on that side and it's pooling. So we want to be able to differentiate those two. So I wanted to kind of give you some background behind the pain, behind the referral of pain, so you have some ideas to ask questions to pull the string, and you don't end up just treating the symptom because it's never going to work. One last thing, when you're treating a problem and it doesn't solve, you got the wrong problem. So this gives you some insights on possible other issues.